King's A&E. Lovely. Cheers, bye.
Adult trauma call, 8 minutes. Adult trauma call, 8 minutes.
I've got an unconscious gentleman he has severe traumatic brain injury.
King's College Hospital, London.
I think something hurt.
One of the busiest A&E departments in the country.
They're a bit busy right now. Yeah, 15 minutes, 30 minutes.
King's is extreme, isn't it? Come on.
A place where love, life and death unfold every single day.
Fall from a tree. It's probably absolutely trolleyed.
I'm very drunk.
I just keep thinking, how am I going to cope?
All the patients you're about to see were treated in one department in just one 24-hour period.
Cavino. Everyone should walk through an emergency room at least once in their life because it makes you realise what your priorities are. It's not the rush, rush, rush and the money, money, money. It's the people you love and the fact that 1 minute they might be there and 1 minute they might be gone.
Just my luck to, like, get hit by a ball on my head. Oh, we're not very good for injuries in our team, are we?
Every year, 3 million of us end up in A&E after accidents that happen during recreational activities, mostly at weekends.
Why didn't I duck? Oh, that's me.
Well, I think majority of people work Monday to Friday, and at the weekends it's time to forget about your stress and enjoy yourself. Unfortunately, I think people enjoy themselves a bit too much sometimes.
Still paying school 8 out of 10.
Look at that, we're cooking with gas. This is how it should be. And we've been busy enough.
Scott has worked at King's for 10 years.
I came into nursing reasonably late. I didn't start my training until I was about 22. But, you know, in my career, I've seen absolutely everything. I remember when we used to have just the big whiteboard here and you used to write everything on it.
Yeah.
Yeah. Piles.
Can I have a reported to X-ray, please?
Carrot in anus.
Carrot in anus. I had ping pong balls in anus the other day at triage.
What?
Yeah, it was a bit embarrassing. Because I was sat there and, like, you know when you really want to laugh? And then I was trying to be serious and asking the questions. I couldn't do it. I couldn't do any obs. I was like, I can't do it.
So what was, sorry, male or female?
Male. And they'd been playing with, they had 4, and he noticed they only had 3 left.
Fair enough.
How are you more comfortable?
Standing.
OK. Right, can I get you... I know these gowns are not flattering at all. If we get your top off now, just because it's going to make it a lot quicker when they come to examine you.
Hi.
Hello, sir. Have a seat for me, please. I'm fine, thank you. Well, how can I help you?
I just got hit in the face with the ball.
What ball is it?
A hockey ball?
Hockey ball.
Yeah.
Any vomiting?
No.
A loss of consciousness?
No.
Okay. So you had it smack in the eye, yeah? Okay.
Pain here?
Yeah.
Okay. Anything here?
Yeah.
Okay, we'll do an X-ray. I don't think there's anything broken. More than likely, you've probably torn that ligament a little bit.
Football is the sport responsible for the most casualties in A&E, closely followed by rugby.
Or is
It doesn't hurt.
It doesn't hurt?
No, it hurt at the time, but it's fine now. My teeth feel weird, but that's it. It's not, yeah, it's fine up there. Okay, yeah, that hurts.
Yeah.
Yes.
There we go. Clean knee. Why am I washing your knee? You're quite capable of washing your own knee. Wipe it.
Thank you.
What am I doing?
It's clean.
All the rugby players put mud everywhere, look. It's in a mud trail.
He thinks it's poo. He thinks it's poo. Why would you put tissue on it and then sweep it up? What is he doing? Ah, here he comes. He's gonna make another mess.
Jesus.
What?
Jesus.
I didn't know he played rugby.
Saturday. As evening approaches, sporting injuries make way for another recreational pastime.
Before you come on shift, you know it's going to be busy, pretty much. Days can be full of football injuries and nights can be full of drunken injuries. You know, unfortunately, alcohol does funny things to people.
I don't need that chair. I don't need that chair.
I'd follow your friend. I would.
A party has ended prematurely for a group of university students.
What can you say, yeah?
Two have hurt themselves after falling from a bar they were dancing on.
Well, things looked like it was a good fancy dress party, though, wasn't it?
Yeah, it was.
Everything just went Pete's on.
18-year-old Fleur has hit her head. And Jessica, also 18, has hit her head and knee.
You look an old woman. Babe, you look an old woman. Babe, what the fuck are you doing?
What the fuck happened there? We were just dancing on the bar, and then what?
All I heard was a scream and everyone...
Are you kidding?
Yeah. And everyone just looked at the bar and where you two had been was gone. And it was funny, but then it was horrible because you didn't get up for like 20 seconds. I mean, you've hurt yourselves, but I thought you'd really hurt yourselves.
I thought it was really God, don't. For a minute, I thought. Please don't. I don't want to think about it. That's what I think, you know, like, I have like, babe, rest your head back. Shh. I got, babe, shh. Stop it, Fleur.
Rest your head back. Rest your head back. Rest your head back.
But then when I start to fall asleep, I feel really drunk, like really drunk.
It's because you are really drunk.
It's true, babe, it's true. I'm not even react because what I want you to do is the toilet and just sleep because you've been knocked out in the head. I'm in the hospital because of it, okay? Shh, shush, okay? It's fine. No, you're fine. Just talk about you, okay? You're fine, okay?
I'm fine. I'm absolutely fine.
Okay, shush.
Okay.
Head down. You're fine. Shush. Shh. It's fine.
It's fine. Go ahead. It shouldn't be long. Half an hour, hopefully. Half an hour.
Like your wishful thinking. My name's Colin Sykes Wilkinson. I'm 32. and I work in construction.
You've got an air of Robert De Niro about you, mate, I've got to tell you. There it is.
What's wrong with you? Arm, get it. How come? What happened?
Little cut on it. Didn't move out of the way quick enough. I was out with mates having a drink in the area and that, and I was coming home from the petrol station. Two people have approached us. So they've asked us the time. I said, no, I don't know the time. And then they've tried to lunge for my phone that I had in my hand. So obviously I've tried to fend one of them off. The other one's tried to throw a punch. And well, next minute I knew there was a knife in the air and one of us cut us with a knife.
I Spy, my little eye, something beginning with M.
Alice is worried about her friend.
We're playing I Spy, My Little Eye.
OK, what are we missing?
OK, cool, that's fine then, that's fine.
Beginning with what?
M.
M?
She wants to talk to you.
Mobile.
Not many people can say they've had a knife pulled on them. What were you thinking when the knife got pulled out?
Well, to be fair, it ain't the first time I've had a knife pulled on us, but yeah, of course you get scared, you see that coming at you, you know, you don't know what's going to happen.
Your turn. Mister.
Who's my turn?
Yeah, your turn.
Oh, blimey. I've been stabbed about 3 times, and I've lost count the amount of times someone has actually pulled a knife out on me. It happens so many times where I'm from, so, you know, you tend to get used to it. Do I actually have to say hi, Spy, as well? Something beginning with, J.
J. Jumper. Babe, this is so hardcore.
You bonded.
Colin?
I'm fine, don't worry.
Well done, Colin. Good luck.
Woo, enjoy it.
What happened today then?
Someone tried to mug us in it or something.
Hit you with what?
Knife, machete, sword, whatever.
Okay. When was this?
About 10 o'clock.
Oh, sounds pretty bad.
Yeah, well, it's not
Did you
too
get any
bad.
other injuries apart from that?
A little scuffle in there, but no, that was it. That's the main one. Well, for me, being a kid up to where it is now, it's just got worse and worse and worse and worse.
Did you hit your head?
Huh?
Did you hit your head, sir?
No, I hit his head.
You hit his head?
Yeah,
Okay.
his nose.
Okay.
If someone comes in with a broken nose, it was him.
Okay, well, I'll keep an eye out, sir.
My opinion, they ain't got the bottle to stand up and have a straightener one-on-one, so they use knives.
Okay, let's have a look. Yeah, bring it towards me a little bit.
Ruined me tattoo, innit? Yeah, I've seen worse than that. I've seen people get hurt worse than that. I've seen too many things, so that wasn't nothing. Is my fingers supposed to be numb?
Let's just have a look at your fingers. Okay. Give my hand a squeeze as hard as you can. Okay, is it? You can't squeeze as hard because of the pain, is it?
Yeah.
Okay.
It's just tight.
So relax for me again. Can you feel that?
It's numb. It's tingling.
Okay.
Yeah, it's proper numb.
So this is numb here, is it?
Yeah.
What about down here?
No, that's all right.
Okay. Yeah.
These two here, it's like pins and needles.
Yeah. Okay. Just bear with me for a sec. Let's get one of my other doctors to have a look at that. Femin, do you mind having a look at the wound for me?
Okay, no, seriously, it really hurts, but like.
I feel so old right now.
Oh, I'm so upset because you look so fit. Oh no, you're so fit as well.
Oh, feel that. I'm serious from now on, okay? Let's be serious.
Stop giving him leaflets.
It's so bad, what are you doing?
Darren has collapsed at a party. His friends Ian and David are keeping him company.
I'm going for a cig.
Just go on your own.
No. I'd rather just go on my own. I don't have time. It's fine. Okay, no, I need to know. Okay, oh, for God's sake, I'm just outside, baby girl. It's fine. You stay here, you can see me just like, hello. Yeah, I'm fine.
Oh, you fagging.
Bad time, me time. Okay.
You let her go out and do that?
No, Dave, seriously. Dave, bad move.
Jen is one of the most experienced nurses at King's A&E.
I'm tired now. Do you know what I fancy?
You've done all kinds of nursing, haven't you? You've been a nightclub nurse.
Yeah, a rave nurse, yeah. I'd walk around the club all the time, making sure people were all right and making sure no one was sleeping.
Like doing a dance walk?
Having a little bit of dance, yeah. Jen the Dancing Medic, that was my name.
46-year-old chap, GI bleeding, vomited blood times once a night, smells of alcohol, probably a anaerobic tear, nothing on his bloods.
I spent many years, like 8 years I spent at Heaven. It was good. It was good. Crazy, but good.
The House of Commons were on the RAS last night. We had a few on our money come in. Anyway, she came in, she got picked up by a pre-booked cab, which was a Bentley, wherever she had been drinking. The poor driver, she vomited all over his beautiful Bentley and pissed herself all over his Bentley.
I think I've seen pretty much everything. What used to shock me 10 years ago, I've seen it. I've seen things up people's bottoms. I've seen people, you know, come in, you know, both of them locked together having sex. I've seen all sorts of things so things don't particularly shock me.
Locked together having sex?
Yeah.
What do you mean?
Well, I don't know if you've ever seen the ER episode when a couple come in and they've been shagging and basically, I don't know how quite it happens, but the woman's pelvis kind of like locks, so they can't actually become uncoupled.
We had a little chat and I said, look, just have these fluids, get yourself sober, and if you still want to talk to someone about how rotten you're feeling, about the fact that you can. Yeah.
But at the end of the day, it doesn't matter who comes in and why they've come in, they still need our services and our care and attention.
Gonna be okay. Relax, honey.
We're just going to try and roll over on her front and over.
Unfortunately, some nights you can have more drunk people than actually genuinely medically sick people. In my past, I've gone out and enjoyed myself till whatever time in the morning and never needed to go to A&E with any of my friends or myself. I find it a bit unbelievable that people do end up with us.
A&E Kings. 2 with 2. Right, yep.
A birthday party has gone horribly wrong.
Right.
The ambulance service are en route with 2 patients from the same event.
Yep, go on then.
I think it's going to get a bit busy in here in a wee while.
It's going to get busy?
Yeah, just to warn you.
Lots of people coming.
Yeah.
OK, thanks.
Saturday night, yeah.
2 HEMS trauma calls, 10 minutes. 2 HEMS trauma call, 10 minutes.
No way.
Yeah, way.
There's been a violent assault at a birthday party. Reports suggest a samurai sword was used in the attack.
Ah! We have 2 from the same incident coming. One a 50-year-old male, head injury, LOC on scene, now GCS 15, that's as far as we got. The second one from the same incident is a 20-year-old male who's been stabbed in the neck and the back. Father and son, so I think they're keeping the family together.
guys.
This is a stab and the next one's a head injury.
Okay.
Okay guys, this is Jamie. He's 22 years old. Approximately 50 minutes ago he was in a brawl with several people. He's got a small hematoma over the side of his head, a stab wound just below his left ear, 2 stab wounds over his left scapula, and a stab wound to his left abdomen.
Any idea what he was stabbed with?
A policeman said a samurai sword was seen.
Saturday night, South London, you do see some interesting things, you know, standard party, but instead of the fight with the girlfriend, you end up with loads of people coming in stabbed.
Okay, ready, steady, lift. That's it.
Okay guys, this is Mo, he's 51 years of age, found about 50 yards away from his son had been stabbed. Witness loss of consciousness for probably 10 minutes, moving all 4 limbs. Injuries, he's got blood from his mouth, some swelling on the right side of his face, no other injuries identified so far.
We were celebrating our daughter's 18th. The boys, her brothers, had gone all out and hired really fantastic lighting and smoke machines and everything else. It's quite an exciting thing for the family. We had a nice mixture of family and friends. It was a really, really lovely party.
Jamie, I'm just going to shine a light in your eyes. Sorry about this, mate.
There were some boys that said they wanted to come to the party, and I said that the party had ended, that they hadn't been invited, and one of them, who was very tall, came down in my face and was very menacing and said, "Don't push me," in quite a scary way. One of them punched my son in his face, and with that, all hell broke loose.
So what other kind of stabs?
I don't know. The doctors know that. I'll ask in a couple of minutes, all right?
Let's have it there, my stomach.
You've a wound there, yeah, just underneath your stomach area.
Stabbed 4 times. Stabbed in my stomach, back twice, and my neck. I can remember falling to the ground and seeing everything around me disappear. It was really frightening there.
Maisie's fine. Maisie's fine, Kate's fine, Lee, Mark and Alt were all fine. Okay, but what you have to do now is be really strong for me.
I thought he would die. That is what I thought.
Is your tummy hurting there?
Just try to relax. Try to relax.
Jamie, are you in a lot of pain or not really? Just when we're poking that thing over there. Okay.
Superficial.
Okay. No. It's disappearing off into the depths there, so... Okay, so... I'm just going to look at the other one as well to see what's what. Can I... Thanks.
Jamie's dad, Morris, is also of concern to staff. He was hit across the head repeatedly in the same attack and is lying in the next bay.
Do you remember what exactly happened? Do you remember anything? What's the last thing you can remember? Where were you? Were you in the street? Were you at home? Were you elsewhere?
The fact that you prepared to turn getting turned away from a party into a reason for a knife fight, it's terrifying.
Chest X-ray for him, chest and CT scan for him.
For us, it's your Saturday night on call, and you know you've got a few stories to tell afterwards. But the effects on families is profound. How do you remember that? How does that go down in family history? It's not really talked about. How that small snapshot is affecting people for the rest of their lives.
It's quite a deep cut.
No. Hi, my name's Shameen. I'm one of the other doctors.
2 hours ago, Colin was also attacked with a knife.
We're just going to have a real good look, yeah? I just need to see how deep this goes, yeah? I'll be as gentle as I can. Tell me if it gets too much, yeah?
Doctors think he may have suffered some nerve damage.
No, I'm just going to go a little deeper. Tell me if it gets too much. Tell me if you get any pins and needles anywhere.
Just that baby finger there's the one.
You getting pins and needles in there now?
It's been there constantly.
Okay, I know the numbness has been there.
Yeah, that hurts.
Tell me if that pins and needles gets worse.
That hurts.
Sorry. You got fascia exposed, yeah? Just the surface of your muscle, alright? So I need to flip the skin back a little. Try and bear with me, yeah? Okay. Alright, this bit is pretty superficial. This bit extends down below towards the arm leg. I think you need to speak to plastics, yeah?
I was due to start a job the following day. And I work hard for what I get, so, you know. So if I don't get stitched up, will it just heal naturally?
No. You will get infected. So what sort of work do you do?
Bricklayer.
You won't be able to lay brick with that, sir, I'm afraid.
No, I'm trying to say. I've got 4 kids, you know what I'm trying to say. I need to work.
You can't work with that, mate.
I had to work my socks off to buy what I buy. Instead of them going out and trying to earn that money, the legitimate way, they'll just try and take it the easy way.
You do have a legitimate reason to take time off work, so there's no... They can't do anything, they can't, you know, they can't fire you for not taking off work, because you need surgical help.
Okay, cushy. Thanks a lot, yeah? Okay. Obviously, I couldn't go into work on a building site with that room there, you know, just dust and all, infection and all that, so I couldn't actually go to work.
How are you doing, Colin?
Content, but I'm gonna have to wake up. Look, it is as well. It's gonna break my heart to take it, but I've got to go. You know, life's too short. So you just got to make the best of it and just crack on with life.
Sit up slowly.
Sorry.
Colin's just gonna take his jacket.
All the best. Yeah. Right, that's right.
Why am I the only one in a gown? What happened there? Did I miss a trick? Why am I the only one in a gown? What happened? Why have I been victimised like this?
Like, my mum, when she worked at A&E, she's like, it's awful. Like, she's a qualified doctor. The amount she had to work, like, day and night. It takes so long. No, it's awful. Think people come in, they've just inflicted it upon themselves. If that were me, I would have no sympathy whatsoever.
What happened tonight? Catherine, try and answer me.
You have to answer the guy's questions, okay?
Yeah, spit it out. Spit it out if you have to.
Catherine is 21 today. She was out with friends when she began to feel unwell and then started to lose consciousness.
Okay. Catherine.
Catalina.
Catherine.
Kiki.
Catherine. Catherine.
Catalina, your doctor. Come on up.
Charlotte, Nikki, can you give me a hand here, please? Please get out of the way, please.
Yeah.
Catherine.
Kiki.
Stop breathing there for a minute. What about apnea? Yeah.
Catalina, I said that to
She's all right now.
Relax, I got you.
I don't know. Their friends are all right. Like, it's just they're querying maybe ecstasy or something, but I don't know because everyone else is all right.
Wake up for me. Catherine, wake up and sit up. Come on. Okay, stop worrying your friends. Sit yourself up for me and wake up a little bit. No. Come on, open your eyes.
Yeah, spit it out. Spit it out if you have to. This is Jen. Yeah, beautiful. Thanks, mate. Thanks. Bye.
Jen is the senior sister on duty.
A&E Kings. Hello.
She's responsible for coordinating all medical care in the department.
You know, all my staff are out in CT and I'm the only one in Reza. Yep, go on. What's wrong? Brilliant.
Okay, thanks. Bye. Yeah, can I have an adult trauma call, A&E resus, please? Yep, thanks. Bye. HEMS, trauma, 5 minutes. HEMS, trauma, red phone, 5 minutes. Hey, Darren, it's Jen. Is there any free nurses that could give me a hand, seeing as I'm the only person in resource and I've got another trauma call? No. Sure, thanks. Cheers, mate. Bye.
Just keep breathing. Just keep breathing. Come on. Come on. Yeah. Yeah. Good girl.
Did she say she took drugs tonight?
I don't know, it's a possibility.
Yeah. Yeah.
Possibility.
Yeah, no, got it all over you.
This way. Relax.
Sorry, she's been asleep quite a long time.
That's all right.
3 hours after falling off a bar, Jessica's knee and head are about to be assessed.
Okay.
Okay. Take a seat on there. She's fine. It seems like she's really disorientated, but she's just tired. Okay. The longer we keep you awake, the easier it'll be. Okay. Do you want to tell me what's been happening?
Yeah.
What happened?
Well, tonight, I think I got very sleepy, and I think I fell asleep.
No, as in with your knee.
Oh. Well, I think I got very tired.
Should we tell you what happened?
And I think... Okay. No, I know. I'm not stupid. No, I know. No, I know.
Do you know where you are?
Yes, I do. I know I'm in a hospital, in an NHS hospital.
I just need to ask you a few questions. They might seem a bit silly, but it's important, especially if you hit your head. What day is it today?
It's Friday. Must be the 21st today.
Okay. Today is... I would accept it's Saturday or Sunday.
I'm sorry.
That's
sorry.
all right.
But I know it's 22nd. I know. I'm sorry.
And do you know the name of the Prime Minister?
Yes. No, it's not Tony Blair. It's Gordon Brown.
Sorry.
Sorry.
And now she's sleeping on my hand, and there's nothing I can do.
Following her arrival 2 hours ago, Catherine has caused some concern.
Catherine. Hiya. Catherine.
Kiki.
Wake up for me.
Kiki.
Doctors still don't know why she collapsed.
Okay. Catherine, come on, darling. Wake up for me. All right. Turn around for me. Let me have a little look at you, okay?
You have to be on your back.
Wake up, sweetie. I love the eyelashes, by the way. Come on, sweetheart. Up you come. Come on. Come on, sweetheart. Up you come.
There we are.
Sorry, it sounds like we're being forceful with you, and I know it's horrible.
She'd sort of said to us that she'd wanted to go out and maybe take something.
Right.
And
she was talking about
she talked, I'd get the coffee away just, and she said that she had taken something, but she wasn't alone at all to take anything. There was she didn't have any drugs on her at the house.
Right.
There's no one in the house that takes
We don't know
drugs,
if
that
someone's
has
actually
drugs.
given it. So we don't know if she has taken it, first of all. We don't know
I
where
don't
she's
think
got
so.
it.
To be honest, she can be given to exaggerate sometimes, and I think that, and I've just dismissed it as her exaggerating that she'd taken something. So, Kiki, if you have taken anything tonight, you need to tell the doctor.
Okay. If not, we do need to do some blood tests. Okay.
To be honest, knowing Kiki, that's probably actually your best bet.
I think you should do a blood test.
We see the extremes. We see the people that have too much of a good time. You know, there's still probably 2 million others that don't actually go to A&E at all, and that's what you've got to remember, you know. The minority of people that go out end up with us.
Kiki, if you did take something tonight, you desperately need to tell us.
Don't be heading me away like that.
5 minutes.
5 minutes. I will just because I said, do you not think you could have gone somewhere else? Not being funny, but you know you've just brought 2 traumas. All my nurses are in CT. We're just round the corner.
It is that time of the morning, isn't it?
So, guys, this is an unknown adult male approximately 1 hour ago was found collapsed in the street unconscious with a head injury. He was GCS 7 with us. He's had an RSI for his decreased GCS, pank time at 3:52. He's had a total of 3 milligrams of morphine.
An hour and a half after being stabbed at his sister's birthday party, Jamie has returned from his scan to find a much busier resus room.
Okay, guys, you happy with his ventilation, John?
He hasn't seen his dad since they were both attacked.
Thanks.
You back from CT with him? Thanks very much.
Oh, no. Well, I tried to have a word last time. You need to go down there, mate, please.
That's my dad.
No, it's not.
That's my dad.
It's not. It's another patient, honestly. He's down in Bay 5. Do you want to go and have a look?
Okay.
It's another patient, darling, I've just told you. Your brother's in there and your dad's in 5, yeah?
Can I ask you a quick question?
Yeah. What?
Do you want to see CDU2's just got 1 patient in?
Yeah.
But there's people coming up for 3.
It's standing up on the trolley, peering over into cubicle 2. Do you want to sit down now, please?
How's he doing? Is that my dad next door? Just
No, it's not your dad. Your dad is in Bay 5, and I told you you could go and see your dad.
No, thanks.
Sit down now.
No, thanks. Can you not be mad? Can you
Sit
not
down.
be rude, please?
Listen, mate, I've got 5 patients that are really sick in here, including your brother and your father, and I've told you where your dad
understand the
is.
situation I've gone through tonight, yeah? I don't want to be rude
Right,
or
come
anything
here.
like that.
Put that bottle down. Listen, and don't be peering over the top, mate. This bloke's really not very well.
I know in the hospital at one point, Jamie had got quite stressed because he wanted to know where his dad was. He was very worried that something worse had happened and people was hiding it from them.
It's not. I thought it was done. And I told him that it's not your dad.
And everybody was very, very stressed. So, yeah, it was a difficult night, that one. It was difficult to manage. When you've got a massively busy department, I think you have to show an exterior that you're a little bit hard.
Can you blame me? No,
sit down. No, I'll take your piss pot.
You know, if you don't mind, let's have a bit of privacy. Get back in your cubicle.
Thank you.
It's all looking quite busy suddenly here.
With so many patients in resus, there are no senior doctors available to the rest of A&E, leaving the less seriously ill patients with a wait.
Got some gloves. Why are you taking them? I'm going to put them on. Because, all right, are we allowed to do this? What are we going to do? Take them back? Why have they put us in here unadvised? There's so many things to play with.
Oh my god. If I could take a picture, like. Oh my god, it actually fucking hurts. It says, how are we doing? You're doing shit.
They're not doing shit, they're trying their hardest. Someone pissed in the seat.
No, it's so bad. Fucking hell.
Okay, hang on. I'll get back to you. Okay.
You've got 2 patients in minors that want to know what's going on, apparently.
I've already told everyone down in minors that no one's...
No worries, no. I mean, we're down on staff and I've got 5 patients now, going to be 6 in here, so I'm not going to spare a member of staff out of majors to go in there.
This is ridiculous.
There's no point, like, let's just go.
The girls from the fancy dress party are still waiting to be seen. They've been joined by a university friend.
Is there any doctor free after seeing anyone else? A doctor who can literally just look at the car and be like, it's not made up, she can go home and see tomorrow morning.
It's as simple as that, because she's been seen already by the specific doctor.
Been seen already.
She hasn't been seen.
No, but she hasn't been seen.
She's been, what?
She hasn't been seen by anyone.
It's fine.
Literally, no one's seen me. Let's leave.
No one has seen her. Yeah, the doctor already started writing you.
What, saying what?
She hasn't been written anything. So she's going to see you. Sorry.
In what,
like,
like,
she goes to see me in half an hour and I've been sitting there for like...
Ridiculous.
Well, it's up to you. If you cannot wait, I'll just let you sign a, you know...
Well, at the end of the day,
okay, fine.
it could be your fault.
It's not about signing a release form or anything like that.
What we're concerned is the head injury. That's the thing. So it needs to be seen by
But she's
the doctor.
quite evidently not concussed at the
But
moment,
still,
so
the
I don't
doctor
understand why
has to
she's not
see
being
her.
seen.
The doctor has to decide.
Is there any other doctors free or not at the moment? At all? Any doctors at all? What, you have what? Every doctor is
Have
in?
you seen any doctor here? No, we
haven't
haven't
seen.
seen. That's
Over
what I'm saying. Well, that's Max Fox. It's not any doctor.
So he can't literally look at a cut and be like, that's...
She just needs a tiny bit of glue.
So there's no one actually qualified to do this right now. Okay.
I've never had to wait for anything.
Nothing, my dad. Just go and stick my hand up, done, out again.
Exactly the same thing. I've never had to wait for anything, but you know, you've got to like...
I can bring my dad up. I can bring him up.
I think actually we might move these 2 next to each other. And then everybody's happy, yeah? I told your brother that he was in Bay 5 and peering over with someone who's intubated and not... I know, but it's not, you know, come on. I would never lie to anybody where their dad is, would I?
I think we went through something together that night. It happened so quickly and it was so serious. There's just a massive reality that, you know, this could be it. This so quickly, in a matter of seconds, you know, 2 members of our family could have just been taken away.
It's difficult because you've been drinking as well to know what the amnesia is due to, if it was due to the alcohol or to the head injury. But I'll come clean that up and we'll just glue that. There's 4 traumas and a stroke, like all in the last, like, I don't know, they all came in one after the other. It's crazy. Really crazy. Everyone's everywhere.
I think everybody deserves to be looked after and loved and cared for. Some of the things that we see, some of the things that we do, that can make you a little bit, you know, what's the world coming to? Why does it have to be like this?
Thank you. Thank you so much. Thank you.
You know, I do feel sad sometimes that people aren't always what I would like them to be, but I have to think that it's not everybody's like that. You know, there is good and bad in everybody. And then you save someone's life, and it's absolutely amazing. There's no better feeling.
Catherine, the 21-year-old birthday girl, has had a dramatic change in condition. After 3 hours in A&E, she's woken up and got dressed.
Yeah, she's just sitting down in there. She went to the toilet by herself.
Okay.
She wants to go home. She doesn't want to stay here any longer because they need to talk to you just quickly, and they can't talk to you out here.
Can I put some on my face?
I've got moisturizer here.
Don't know what's wrong with my
face. It burns a lot. Get it off, get it off. No, it burns bad. It burns bad.
I'm just going to get some toilet paper, just 2 seconds, okay?
He's basically been crushed between a cherry picker and a parked car, and he's managed to have his chest and his abdo and his pelvis all kind of crushed in this single motion.
You'll still find people that think, well, I'm only just nipping up the ladder, so yeah, I'll hold a cup of tea, a drill and something round my neck with one sock on and a flip-flop.
You were cleaning the window?
Yeah, cracked the glass and went through.
Oh dear. What happened here?
If you are a carpenter and you've got all your fingers, you are not a good one.
They slip on the flip-flop, they spill the tea that scalds them, the drill goes through the head and they break a leg when they fall. They really think, oh, I shouldn't have really done that, should I?
you.